All right, good afternoon, everyone. I see everyone's joining now, so we'll just give another minute and then we'll get started. All right, so we'll go ahead and get started. So good afternoon and welcome to our March seminar. Today we will have Dr. Natasha Schaefer Solle and Cynthia Beaver presenting on the Firefighter Cancer Survivorship Program. So a little bit about Dr. Solle is a research assistant professor at the University of Miami, as well as the co-deputy director of the Firefighter Cancer Initiative. Her research interests focus on the occupational cancer risks, as well as improving cancer screening in underserved communities. She leads multiple projects within FCI to develop methods of education about prevention and early detection of active and retired firefighters. And Cynthia Beaver is a clinical research coordinator for the Firefighter Cancer Initiative with experience in clinical and behavioral health studies. She's been part of the FCI team for over 4 years and is involved in multiple projects, including women's health and cancer survivorship. So as a reminder, if you have any questions, please make sure to put them in the Q&A function at the bottom of the screen, and we'll be responding to all the questions at the end of the presentation. So without further ado, I'll hand it over to them to begin the presentation.
Great. Thank you, Tara. Thank you so much. Hi, everyone. We are really looking forward to presenting some of our work today on our Firefighter Cancer Survivorship Program. So I feel really lucky to be co-presenting with Cynthia Beaver. She is our head coordinator for our cancer screening education survivorship program, and my main partner in crime when it comes to our screening program. So to get us started, I just want to give a little bit of, an agenda of what we're going to go through today. So we'll do a little bit of a background on cancer in the fire service. For those of you who have attended the symposium and past seminars, you probably have heard a lot of this data, but we just want to give a brief overview. And then we'll talk a little bit specifically about our Firefighter Cancer Survivorship Program and the projects that have gone into them. And then I'll talk about 2 other programs within the Firefighter Cancer Initiative that really are focused on our survivors, our firefighter survivors. And that is our FCI Nurse Navigation Program, as well as our FCI Tumor Bank. So to begin, a little bit of background on occupational exposure as a firefighter. Many of you have probably seen this. This is the 2010 IARC monograph. And so as we know, in 2010, when scientists met and the data that was available at this point, they showed that there was large variations in exposure across different types of fires and different groups of firefighters, which showed an increased risk for testicular cancer, prostate cancer, and non-Hodgkin's lymphoma. What the occupation of firefighting was classified as in 2010 was 2B, which was considered possibly carcinogenic to humans. And so for many of you, I know you're learning a lot about IARC. It's been a hot topic of discussion, being that IARC met most recently in 2022. And so you can see here the description of each group and how cancer is classified or occupation is classified based on their risk. So you could see 3 as non-classifiable, 2B as possibly, which is what we saw firefighting in 2010, 2A as probably carcinogenic, and then 1, which is considered carcinogenic to humans. And so I share this information because in 2022, the IARC met again with scientists from all over the world to come together and discuss new evidence and new research that had been done in the last 12 years as far as firefighters' risk for cancer and their occupational exposure, specifically as being firefighters. And so the main thing that came out of this was a change in the classification for firefighters and the occupation. And so what we saw was there was sufficient evidence for cancer in humans, that the occupational exposure as a firefighter is carcinogenic to humans. So it went from a group 2B all the way to a group 1. So they were able to look at 3 different areas. So they looked at the epidemiology studies, they looked at mechanistic studies, as well as exposure studies. And so we saw strong mechanistic evidence in exposed firefighters for genotoxicity, epigenetic alterations, oxidative stress, chronic inflammation, and modulation of receptor-mediated effects. We also saw with studies focusing on exposure that firefighters are exposed to combustion products, diesel exhaust, building materials, asbestos, chemicals, shift work, and ultraviolet radiation. And we also know, and things that we've been studying here at University of Miami specifically, is the different exposures based on the different types of firefighters. So depending on the subgroup and how their risk may be altered based on the environment that they're in. So one, looking at structural fires, wildland urban interface, also looking at fire trainers, fire investigators, and volunteers. And so here you can see on the right-hand side, and you can scan this QR code to look at the initial article that came out that was just a release of this announcement. And this was back in, let me say it, in June that it came out. And this is just a preview of the actual IARC finding. So that should be expected later in the next few months. But it is a very large document that will be coming out that will show everything, all of the studies that the scientists went over when they met in France at the end of 2022. And it's about a 1,000 page document. So still looking forward to seeing that come out in the future. And so again, we talked about IARC being now a group 1 and known carcinogens. And so we know with some of the exposure studies that have been conducted, these are common carcinogens or chemicals that we are seeing at the fire ground, including arsenic and benzene, formaldehyde, asbestos, and then of course diesel exhaust, which not only are we seeing at the fire ground, but also at the fire station. So this is just a little bit of background as far as exposure data. As far as some of the epidemiological work that's been done most recently, and this has been led by Dr. David Lee here at the University of Miami, where we looked at a linkage data where we linked firefighters' risk from the State Fire Marshal's Office, linking firefighters to the Florida State Registry and seeing the actual cancer incidence in Florida firefighters. And this was, the linkage took place from 1981 to 2014. And so what we saw here, that there was an increased risk here of an incidence or an odds ratio of 1.56 for melanoma in male firefighters. We also see an increase in prostate, testicular, and thyroid cancer in our male firefighters. And then we see an increase in brain cancer and thyroid cancer in our female firefighters. And so this is just for our Florida firefighters. But again, just to give you an idea of what we're looking at as far as numbers of cancer incidents in the fire service. And so when we create any of our projects and any of the initiatives that we do within FCI, we really base things on the cancer control continuum and where these things would fall. And so, as I mentioned, I lead our cancer prevention, screening, education, and survivorship program. However, when we started in 2015, we really were focused just on prevention and detection. And so, as every study that we have, it is very much and actually totally driven by firefighters. And so about 3 years into FCI, we received feedback from firefighters saying, everything is great, what you all are doing with screening and prevention, but what about our firefighters who are already diagnosed with cancer or, survivors and what can we do? And so that's really where we took this on and made survivorship a huge piece of the Firefighter Cancer Initiative. And so it's not just one project, but there are several projects that fit within our survivorship program. And so, as we talked about, earlier, as far as the unique occupational exposures for firefighters and putting them at an increased risk for several cancers compared to the general population. We know that the current survival rate for all cancers combined is 70% among white and 64% among Black Americans, and this is the general population. And so we know that the number of cancer survivors are increasing due to better screening and outcomes in oncology. And so with that, we know that firefighters are also becoming a larger, firefighter cancer survivors are becoming a larger population as well. That is an understudied group. So with that, we wanted to study our firefighter cancer survivors, really understand, what their challenges were, what are their priorities, and really see what some of their needs are. And so with that, our goal was to look at the unmet needs of firefighters and their health-related quality of life. And so I'm going to give you a little bit of a snapshot of how we created our survivorship program. So phase one, which started a few years ago, this was our formative work. This is where we did some qualitative focus groups. And this is where most of our studies, or how most of our studies begin. We want to ask the questions of why and what concerns, what challenges, what resources do firefighters need for us to then create something specific to firefighters and that's tailored to their needs. And so our phase one is we collected qualitative data, asking these specific questions. We were able to have output and then do an analysis. So our 1B was actually analyzing the data. And from the findings of that of phase one, we were able to then create our FCI intervention portals, which we will go over in a little bit more detail shortly. Our phase two of this program was taking what we created as far as an online educational portal and intervention, and testing it with 2 groups as a pilot test. So a total of 10 firefighter cancer survivors to really look at the usability and feasibility of this program. And with that, we were able to then revise the initial intervention based on the feedback of firefighters and what they thought worked, what didn't work. And then now where we are here is phase 3, which is currently enrolling FCI or firefighters into the FCI survivorship intervention. So to start off into phase 1, Cynthia will take the lead and share some of our findings.
Hi, everyone. It's very nice to talk to you all today about this wonderful project. So the aim of this study was to understand the unmet needs of firefighters and their experiences with cancer after being diagnosed. So yeah, we just wanted to ask questions so that, we could do something about it. So the methods for phase 1 was a mixed method study where we had focus groups. We had a total of 4 focus groups, and we talked to 29 firefighters. We collected surveys to look at their socio-demographic characteristics, also to determine their needs. And we also wanted to look into their health related quality of life. And we collected several surveys. One of them, very important, was the FACT-G. So some results here for the socio-demographic characteristics. Most of them, or the mean age was 53 years old. Most of them were male. We had most of them non-Hispanic, all of them white. A lot of them married, college educated, and earning more than $75,000 per year. So when we did the focus groups, we analyzed the data and we looked into different categories or domains of the concerns that the survivors voiced to us. So we divided it into 3 categories. The first one was managing health and well-being. That included mental health, physical health, and changes in outlook. The next category was navigating existing support, which was with family, the fire department, their peers. And the other one was resources. They wanted to see something that was in one place, centralized, where they could get their information, their education, because they told us, well, once you get diagnosed, you kind of go through the rabbit hole and you start looking into different information. You don't know what's real, what's good. So they wanted something that they could go to and get their information. Also, they said that they wanted to get together with other survivors, share their experiences and maybe best practices and things like that. And also, they really said that we want some training on cancer and on ways to prevent cancer. So these are some of the quotes that came out from the focus groups. So again, divided into 3 categories: mental health and well-being, navigating existing support systems, and resources. You can read them there on your own. I'm going to read the last one, which is shorter. Requested resources, more support groups. Yeah, fire support groups like this group. Maybe not inclusive to the types of cancer. So yeah, again, they just like getting together, talking about it, sharing their experiences. I know some of them were like exchanging information, to talk a little bit more outside of the focus group. It's a brotherhood, sisterhood. So this is something that they really wanted. So here we have the results of the survey, the FACT-G. So not everyone, we interviewed 29 firefighters, but not all of them answer all the questions. So we have 27 answers for 27. So physical well-being, so the FACT-G is divided into 4 categories: physical well-being, social well-being, emotional and functional, and then there's a total score. And down here, you can see the ranges of the lower to the upper. The higher the total score, the better, meaning that you're doing a little better. So all of them scored pretty high. The one that scored the lowest was the emotional well-being. And I think this speaks to the need of psychological intervention. I believe, and that's one of the things that they said they needed more to talk, to each other. And so when you compare, the total score was 87.87. When you compare it to the general population's total score is lower. So in this case, you can see that the FACT-G is higher. So firefighters are generally doing a little bit better than other cancer survivors. We believe that it could be the fact that, they're very tight, as a sisterhood, brotherhood. So that really helps. And of course, we interviewed a lot of active firefighters as well as retired, but of course, physical well-being, most of the firefighters are, really strong people. So they're in good physical shape. So I think that all of that put the score a little higher as compared to the general population. So here, as Dr. Solle mentioned, once we gathered all that information from the focus groups and analyzed it, then we were able to put something together. So this is something new, and it's really good. We were able to put together a portal with the different sections in it. It's a total of 10. So the way we're doing this is we wanted to do a 10-week program. So we would do one module each week with an interventionist, and they would talk about the different things. And there's a lot of good information in these portals that can really help the firefighter cancer survivor. So yeah, this is what happened after phase 1 of the study, which was the focus group. So again, it was focusing on getting good information, reliable information to the firefighter cancer survivors, and also making it so that we could add a cognitive behavior stress management intervention that was specifically for firefighters. So some of the things in the portal, for example, this one, which is the cognitive behavior part, partnering with my health system and providers, is ways of, finding a provider, talking to them, asking questions. And we have some exercises in there, and a lot of good information. Yeah, this is an example of one of the exercises. When they go through the program, again, they have an hour to an hour and a half with the interventionist and a group of other 6 firefighters. And they just talk about, specific to that week. In this case, this is just an example of how to communicate with your treatment team. And it's just like questions, exercises, so that they can start thinking about what they need to do or how to better address, their needs. And the online portal, again, it's a 10-week program. So there's different activities, and they'll get, a different reward every week, depending on how many exercises they complete. So the more you participate, the better. And again, as we mentioned, this is tailored to firefighters. So we have information on, okay, what do you need to do when, if you're undergoing cancer treatment, what do you need to do to return to work? And it's very useful information for them to have once they're ready to return to work. So the survivorship program, the cognitive behavior stress management, CBSM intervention, that it basically, again, like I mentioned, is a 10-week program, about an hour and a half once a week with an interventionist, and it's done via Zoom. We collect the information via RedCap. We consent the participants, and then they go through a battery of surveys that's specific for cancer survivors. So we do the FACT-G, promise, acceptance and action, partners in health, meaning and purpose. You can see it's a big list of surveys that are validated, psychologically validated for this population. We also collect participant feedback, and we also ask the participant for a blood spot. And sometimes people get a little scared, but it's just like a little finger prick, like when you're doing a glucose test. And that blood collection is done at home by the participant. We provide instructions, and it's done before the start of the intervention, and then the after, and also 6 months after, just to see, any changes in, those stress hormones. Just to see how well the intervention, if it had any effect, the intervention, basically. So these are some results about the pilot, the phase 2 of the study. So the firefighters that participated, again, it was, sorry, let me back up. So we finished phase 1. Phase 2 was the ones that were basically testing this intervention. So this is the data that we're presenting here. The age was around 53 years old. Most of them had spent 26.3 years in the fire service. Half of them were active, half of them were undergoing cancer treatment, and we have survivors from different parts of the country. So it's not only Florida, but we extended it to, everyone in the United States. And as you can see, there's different types of cancer diagnosis. So it's a wide range of, it's very diverse people. So some of them, the pre and post intervention, so the survey results, we did some pair T tests to determine, the significance from when they started, before the intervention and then afterwards. However, we didn't see any clear changes. Maybe it was a small sample size, or, this was the pilot, right? So it was not, basically they were telling us, okay, this is what you need to change to make it better. And maybe that's why, we didn't see any changes. We're expecting to see changes when we do, phase 3, which is the really good program that we have for them. But we'll see. And again, we'll do the battery of all those surveys, the cost TF. We're gonna look into emotional well-being, functional well-being, etc. And some other tests to see, if there's an improvement before and after the intervention. And like I said, it's small sample size, is exploratory, and we just, collected information for 3 months. We didn't do the full 6 months that this phase 3 will take. So the feedback that we got from the phase 2 participants, it was really good. They found it useful, easy to use, easy to learn, and they overall they said, this is a good thing. You need to. They were telling us you need to get it out sooner, but as some of you may know, sometimes it takes a little bit of time to do, something great. That's what we're aiming for. So some of the also other categories that they talked about is they like that we had a confidential setting for them to discuss their issues, to talk to other firefighters. They liked seeing that we have a meditation portion. Not all of them like it, but most of them did have, because of course that helps them to relax and reduce their stress. They like really helping others with their experience. Some of the ones that were in remission were talking to the ones that were going through cancer treatment, so that helped them a lot. Also, the challenges, they were discussing the challenges of returning to work and how to, maybe talk to their peers about their diagnosis and how to, heal emotionally. Also that this phase helped them to set goals for them and for their work. Also help them with nutrition, exercise, sleeping habits, and just, that they could do the best of it, even after cancer diagnosis, live a normal life as much as possible. So what we want to do now is we're getting ready to do the next phase. Hopefully the end of this month, beginning of next month, we'll have it ready. Again, we make modifications based on the feedback of the phase 2 participants. And so yeah, we're gonna, start calling people soon so that we can get this started as soon as possible. But just know that we're doing our best here to make the best program that we can so that they can benefit from it. Yeah, and if you know of anyone who wants to participate, this is the flyer. You can scan the QR code or, contact me directly. It's for firefighters who are at least 21 years of age. They need to be US firefighters and a cancer survivor. So active and retired are welcome.
Yeah, and just, so the term cancer survivor, so it could be someone that just received a diagnosis, someone that is going through treatment, someone that is a survivor and is in remission, has been a survivor for 5, 10, 20 years and want to participate. So all are welcome. Thanks, Cynthia. So next portion of our survivorship program that I want to talk about is our nurse navigation program. And so this is really led by our clinical team and our nurse navigator, Johanna Garibaldi. And so what is our program? So the mission of our nurse navigation program is to improve the cancer experience for every firefighter cancer patient. Our FCI navigation team provides compassion, guidance, and support throughout the treatment journey. And so here are just a few, bullets or points that our nurse navigator assists with. So Johanna provides assistance with scheduling, a diagnostic screening, collection, helping with collection of medical records. And so this can be something either not necessarily if you have a diagnosis, but if you just need to get a screening visit, she can help you set up that appointment. If it is something for an initial or a second opinion, maybe you went to see your primary physician, they saw something that was abnormal, and then you want to get an initial opinion from an oncologist here, she can help you with that. Or if you received a diagnosis somewhere else and want to get a second opinion, she can facilitate those appointments. She also provides education on cancer treatments and potential side effects of treatment. So a lot of times firefighters say, this is what they told me. What does this mean? And since she's been doing this for several years, she has a really good grasp on the different treatments and, the side effects and the outcomes of what, has happened in the past for other patients. She also provides education on the Florida Cancer Bill and navigating your benefits through your fire department. So a lot of times, as we mentioned in the cancer survivorship portal, we provide this type of information that's tailored to firefighters of communicating with your department, with leadership. But a lot of times people are unaware and don't know what to do or where to start. So Johanna definitely helps with that as well, as far as speaking with your, leadership within your department, with your local union, and how you can navigate the benefits. And so here we put together just, if you were to be diagnosed with cancer, what are the steps and what should a firefighter do? So one, call the FCI Nurse Navigator at 305-243-FIRE. This number is our clinic number. So this can be used not only for a cancer diagnosis, but if, again, any type of screening that you need, any type of second opinion, if you're looking even for a telemedicine visit with our nurse practitioner, that you want to have your annual physical done, based on our firefighter screening guidelines, you can call this number. But going back to if you're diagnosed, and so what you would do is on the initial call with Johanna, you would share the diagnosis details, and she will assist you in scheduling an appointment with the appropriate provider. So many times, people are at loss. They don't know where to go as far as which doctor do I choose, which specialty does this go under. And so she'll navigate you to which specialty it goes to, which providers she suggests, and providers that we've worked with in the past, specifically who know the cancer risk of firefighters, and then scheduling your first available appointment. And so what will happen is once she gives you the information, the patient will call into the system, the scheduling system, and schedule whatever the first available appointment is. Sometimes, as we know, the health system is very busy, so they may give you an appointment a month, 2 months from now, but it's not a time to freak out or fret. So you would just let Johanna know, and she works on the back end to expedite the process, and she'll move your appointment forward. And then you'll start working with the site disease nurse. So if you are diagnosed with thyroid cancer or prostate cancer, you're then going to start working with that site disease nurse. They will call you, but Johanna will be there still every step of the way to assist you with any questions that they may have. They again, they'll be asking for your medical records, any other testing, any other screenings that you've done. And so she'll assist you and facilitate that as well. And then you're always going to connect with her, as she'll serve as the main liaison, even after you see your doctor. And so that's just, if you have a question of like, oh, I went for this appointment, I had the screening, but then I didn't hear back, or they sent me something, or they called, but I didn't really know what to do. She is always available for our firefighters. So it's a long-standing relationship. It's not just something where she schedules you for your appointment and that's it. So this is a service that, we really hold as a top priority as far as part of the Firefighter Cancer Initiative, so that our firefighters are being seen as VIP patients here at Sylvester. The other thing I want to note is that even if you're not local, let's say you live in a different state, or you live, in North Florida or the Panhandle, we still recommend calling Johanna. One, if you wanted to come to Sylvester for a second opinion, but two, just for navigation services advice, as far as, I may not live where you live. However, these are the questions you should be asking. These are people you should be getting in contact with in your local area. And the other thing is, we've worked with several fire departments and cancer centers throughout the country. So it may be something that, we have a connection with, someone at MD Anderson in Texas, or maybe we know someone at Duke in North Carolina. So if, you don't live in Florida, we also always encourage firefighters to reach out just to get, another opinion or any type of assistance that Johanna can provide. And so our last thing we're going to talk about related to our survivors is our FCI tumor bank. And so what we started this actually in the very beginning in 2015. And it was the development and implementation of an occupation-focused tumor bank for firefighters. So we still sit as the only firefighter-specific tumor bank in the country. So as we know, we look at the epidemiologic studies that show an excess risk for site-specific cancer mortality, and then attention to disruptive chemicals that may influence the tumor geneticist, including cancer initiation and progression are needed. So when we using that data and that, past literature, that's what gave us the idea to start this tumor bank when we started FCI. So the purpose of the tumor bank is to investigate the mechanisms of cancer and workplace exposure using fresh tumor specimens. And our objective is to establish a tumor bank to make these specimens available to cancer researchers at Sylvester. And so as far as the data collection and what we collect from the tumor bank, it's very simple as far as being the participant. So there is a survey where we ask questions related to your health information, your cancer history, as well as occupational risk and experience. And then it's a matter of signing a few release forms. So your medical and health records, your labs, imaging, as well as the biospecimen release. So these are all done online within our REDCap data management system. Once we receive the signed release forms and HIPAA forms, then our team can contact your healthcare provider in the labs where your tumor was removed and get a sample. So it's really more on the back end things that we do once you release it. And so, we'll contact the pathology lab, they'll send it to us, and then it goes straight into our bank. And so to give you just a few updates of some demographics of the tumors we've collected since 2017. So we have a total of 97, with 28% being the ages 40 to 49, 31% 50 to 59, and 30% over 60 years old. Again, we include both active and retired firefighters in here, so you can see there's a pretty even distribution as far as age. 94% were male, with 10% being Hispanic, and 97% being white. 86% were married. And then as far as education, we saw that nearly 60% had some college or technical school, and 38% with 4 years or more of college. And then as far as weight, we saw that 42% were overweight and 47% were considered obese based on the survey they completed. So that's just some basic demographics of the tumors that we have. And then looking at the types of cancer tumors, you can see there's a pretty good range of the types of tumors we've received. Prostate and skin non-melanoma being the highest, followed by thyroid, kidney, melanoma, colon. And then we have a few as far as leukemia, pancreatic, skin, bladder, brain, lung, rectal, blood, bone, breast, esophagus, lymphoma, and testicular. So we've gotten sorry about that. A really broad range of different types of cancers that have come through into the tumor bank. So again, how can you participate if you are someone that has had a cancer in the past and you know that something's been removed, or if you're currently going through treatment? You can contact Johanna Garibaldi, again, our nurse navigator and also our tumor bank coordinator, and she will assist you with sharing the link to the release form. Once it's completed, then we work on the back end on contacting those labs and getting the specimens over to our lab for storage. And so as far as future directions and takeaway messages, when we started this in 2017, we really focused on Florida. Since then, we've grown significantly and included firefighters from all over the country. So this is something that is national. We're looking to work with other of our other national organizations and partners that we have, including the Firefighter Cancer Support Network, as well as the IFF. So these are things that we are consistently working on to share this information at a national level. As far as future directions of the successful establishment of a biorepository of tumor samples, and then continue to link the work environment exposure data to the tumor phenotype for greater insight on the occupational contribution of the tumor geneticist. So really looking at how firefighters' exposures to certain compounds and carcinogens may impact the actual tumor, and what we see in these tumors if they're different than the tumors that are seen in the general population. And so with that, I open it up to questions and any discussion. And thank you all so much. I really have enjoyed sharing the work that we've been doing and to see how it's grown since the beginning of 2015. So I see a few questions that came through, just wanting to know about the recordings. So all lectures are recorded and they'll be on our website. So you'll always be able to get those, as well as the flyers, which are also on our website for any of our research studies. Thank you. All right. So thank you all for being here. I don't see any questions coming through the chat. Oh, here we go. What method of cancer screening is used in the US multi-cancer? So there are several screenings used for cancer. Really, we focus on site-specific cancers, using evidence-based practice. All of our screenings that we recommend are based on not only the NFPA standards, but also the US Task Force. And so specifically looking at, colonoscopies, mammograms, yearly skin checks from a dermatologist. We also do different blood markers looking at bladder cancer, as well as PSA, cervical cancer, having a pap smear and HPV testing every 3 years, also depending on your age. So those are a few. I don't know if that answered specifically what you were looking for, but that's the screening guideline that we put together as far as our clinical team. We also do labs as far as thyroid panel to see if there's any thyroid dysfunction. We've also done some screenings as far as ultrasounds of the thyroid for our fighters. So we really focus on the cancers that we see high incidence in the fire service. So we use that from the epi data that we've seen. Okay, great. So I see that the direct link for the survivors, we have several members that are willing to connect. So yeah, we can share that information with you as far as the link for the survivorship program. So I can make sure it's put on the website, but we'll also share it on our social media. So you'll be able to see that as well, if that's easier. Great, thank you. Okay, so we have one more coming in. The focus on stress is interesting. Are there any ongoing studies evaluating stress as a factor for cancer or return of cancer, specifically in firefighters? So I know stress is a major factor, and it's something that we always talk about within the fire service as far as risk factor, not only physical stress, but emotional stress, mental stress of the job. And then also looking at, return of cancer for those who have had it and the stress that goes along with being a cancer survivor. I haven't seen any study specifically looking at stress in that way. So I don't have an answer for you. I'm sorry. We're not doing anything specifically on stress. We do look at cortisol levels and how stress changes. But we haven't looked at that specifically as the factor. I mean, we definitely know it is a factor for cancer, and we know that firefighters are at high stress levels in all areas, but unfortunately, we have not opened a study yet looking specifically at stress.
All right, so I don't see any more questions coming through. So we'll wrap it up. Our next seminar will be April 26th at 12 o'clock Eastern Standard Time. And it will be by Dr. Barbara Millay, and she'll be presenting on reporting back on PER. And I think that I see. Oh, that is just a thank you. All right, perfect. Awesome. So we'll see you all then. Thank you all so much for joining. We appreciate it. And thank you so much, Dr. Solle and Cynthia, for the great presentation. So have a good rest of your day, everyone.
Thanks, everyone. Bye-bye.